Next. Next slide, please. Next, I think 15 to 20 minutes I will be explaining brief about this aspect. I will skip the first one or two, that is standards and development process and standard development organizations. Sir has already deliberated in detail on these aspects, and I will start with Ayurveda related standardization activities in BIS as well as in international organization for standardization, and what is the roadmap we have identified for standardization in Ayurveda, and along with some important published standards related to the Ayurveda, and what are the regulatory frameworks presently governing different sectors of Ayurveda, and which are the areas we excluded based on this regulatory framework. As you all know, BIS is a national standards body. It is developing Indian standards for all the sectors, including Ayurveda, and it is well coordinated and well maintained by a huge network of headquarters, regional offices, branch offices, etc. Regarding International Organization for Standardization, this is an independent NGO which is having representation from about 170 countries. There is only one member per country, and there are about 830 technical committees and subcommittees are involved in international standardization related to different aspects, different goods and services, and more than 25,000 international standards covering these aspects are already available in International Organization for Standardization. Many faculties or many stakeholders were repeatedly asking regarding this, regarding submission of the proposal for new standards. As sir already told, proposal can be submitted by any ministry or central government or consumer organization. Even any individual can also submit a proposal for development of any standard. This can be submitted through a dedicated portal created by Bureau of Indian Standards through online mode also. This is the pictorial representation of sir already explained regarding the standard formulation process. Usually the preparation of the any preliminary draft or working draft is assigned to a working panel or working group, or sometimes it is taken by member secretary himself or herself. After discussion, it is converted as preliminary draft, and it is circulated to committee members, and usually for 2 weeks, and the comments then discussed in a sectional committee meeting. It is converted into a working wide circulation draft, and wide circulation draft again it is circulated to all the a large number of stakeholders, and the committee will decide the period of circulation. Usually it is 16 days, but it should not be less than 1 month period for giving comments from receiving comments from stakeholders. And again similarly these comments again discussed for their suitability for incorporation, and that draft is finalized as publication draft after incorporating necessary editorial corrections, etc. And once it is approved by the Division Council, that is published as Indian standard through Gazette notification. These are the different stages as per standards formulation process. Usually when assigning a time frame for development of a standard for any new subject, sectional committee will decide the reasonable time frame depending on the complexity of that subject, how complex it is, and volume of work involved in developing that standard, as well as the extent of consensus that needs to be established before publishing or before developing that standard. Usually proposals that are urgent in nature and directed by the government or ministries, they will be taken up as high priority subjects. In COVID times also there were some requests from ministry to develop standards for ventilators, masks, etc. Such kind of topics are considered as priority 1 subject, and the timeline fixed for that publishing that standard is 9 months by Bureau of Indian Standards. Proposal involving a large R&D project or complex subjects or specific studies or research for validation of any subject, those subjects are considered as priority 3 subjects while developing standards, and 2 years is a timeline for developing from conceptualizing to publishing that standard. And all other subjects which are normal in nature and which do not fall under any of the above 2 categories are priority 2 subjects. We are developing all our standards under priority 2 subject, and it's 1.5 year, 18 months is the duration for developing that standard. Then the important topic, that is Ayurveda related standardization activities in BIS. Though the department was created in 2022, the Ayush related standardization was initiated almost 12 years back, where a Ayush sectional committee was created under Food and Agriculture Department of Bureau of Indian Standards. That is the 26th committee of that Food and Agriculture Department, FAD 26. It was created on 7th September 2012. And after 9 years of creation of that committee, first standard was published in 2021, July 2020, I think, 20. After 8 years of creation of that committee, that standard was on terminology part 1, that is fundamental principles terminology, and that was developed based on the Namaste portal developed by the Ministry of Ayush. And in 2022, the committee conducted last meeting, that is the 12th meeting of FAD 26, and after that in 2022 September, BIS created a dedicated technical committee for Ayush in Bureau of Indian Standards. And after 2-3 months in 2022, 27 December 2022, exactly 2 years before this date, the first meeting of Ayush Division Council was conducted. We have a separate division council for Ayush department now, headed by respected Secretary Ministry of Ayush Rajesh Kotecha sir. And in that meeting it was decided to have 7 sectional committees for each Ayush system, including Ayurveda, Yoga, Naturopathy and other Ayush systems. And we conducted first meeting of Ayurveda sectional committee in 16th May 2022, and as on date we have about 121 standard published in our program of work. It is considered as one of the actively working or best working committee in Bureau of Indian Standards. As I have told, we have 7 sectional committees in our Ayush department, headed by all renowned personalities in the field of respective fields. The Ayurveda sectional committee is headed by Vaidya Jayant Dev Pujari sir. Yoga committee is headed by from Yogacharya Sridharanji from Krishnamacharya Yoga Mandiram, Chennai. And Naturopathy sectional committee is headed by Dr. Satyavati madam from National Institute of Naturopathy, Pune. Unani sectional committee is headed by Asim Ali Khan sir, former Director General of CCRUM. And the Siddha sectional committee is headed by the Director NIS, Meena Kumari madam. And Sovarikpa sectional committee is headed by Padma Gurmejji, Director of National Institute of Sovarikpa. And Homeopathy sectional committee is headed by R.K. Manchanda sir, former Director General of CCRH. In Ayurveda sectional committee, we have representation from 21 member organizations, and we have total 50 members, including 1 member from personal capacity. And in our last 5, we have already conducted 5 meetings in last 1.5 year, and we have identified these 8 areas, and we have created working groups in these 8 identified areas. That is WG1 for working group 1 for therapeutic and diagnostic equipments, and for pharmaceutical equipments we have a dedicated working group, and we have working groups for Kshara Sutra and Kshara Sutra cabinet and test methods, single herbs, test methods to develop test methods for the herbal materials, and to develop drug testing methods of Ayurveda, like establishment of Rasa Panchaka, etc. And we have a dedicated working group for preparation of different dosage forms also. This is the representation from different stakeholders in Ayurveda sectional committee. We have representation from almost all the categories of stakeholders. We have 2 industry associations in our committee. We have 4 regulatory bodies. We have 2 R&D organizations, CCRS and CSIR. We have 5 academic institutions. We have individual capacity member. We have 3 industry associations, 1 consumer group, 2 central ministerial departments, 1 technologist. Total 21 organizations are representing in our committee. During our previous meetings, these are the some areas identified for development of standards related to Ayurveda sector, starting from terminologies related to Ayurveda, single herbs used in traditional medicine. We are publishing it in the name of traditional medicine because we are harmonizing all the pharmacopoeias, and we are taking comment from the stakeholders, and we are publishing it for Ayush perspective in the name of the single herb, particular single herb for use in traditional medicine, not for specifically for Ayurveda. And we are developing standards for therapeutic equipments, instruments and tools. We have identified health and wellness service requirements is also one of the area, and we have identified an area of diagnostic equipments and tools, extra pharmacopoeial herbs, standard operating procedures for different treatment procedures, and in the quality assurance we are planning to work on quality and safety of pharmaceutical equipments and procedures, including packaging materials, etc. It was the initially developed roadmap, and we are progressing as per this roadmap. And till now we have published about 121 standards. Major number belongs to the single herbs. We have published 6 standards on terminologies. We have 2 standards for Panchakarma equipments, Kshar Sutra, and 1 standards for test methadone to evaluate the pesticide residues in the herbal material. Then regarding different categories of standards, these are 6 parts of terminology related standards published by Bureau of Indian Standards, mainly taking Namaste portal and other documents published by CCRS and Ministry as base document. We invited comments, and after incorporating necessary modifications, we published these 6 parts of terminology related standards, wherein we translated the original terms in to English, and for the purpose of clear understanding of the concepts. Apart from that, this is the major area we are working to develop standards, that is standards on single herbs, wherein we prescribed the requirements for confirmatory assessment or quality assessment of these standards, along with the method of test for herbal materials for use in these traditional medicines. In these standards, we are defining the parameters to identify or authenticity of the herb, that is through macroscopical identification, microscopy, along with the powder microscopy. To assess the quality, we are defining the limit of foreign matter in that particular herb. We are defining the loss on drying, total ash, and acid insoluble ash. We are providing the limits, minimum limits for extractive values like alcohol and water soluble extractive values. We are providing the maximum limit for aflatoxins, microbial contaminations, heavy metal, pesticide residue, and including TLC and HPTLC data to identify the secondary metabolite in that plant. For all these parameters, we are developing a standard to test all these parameters. As of now, we provided in the form of annexure, and we are developing a standard for pesticide residue. We have already published a standard. For heavy metal and microbial contamination and aflatoxins, there are some published standards are already available, and for TLC and HPTLC evaluation, though there are some guidelines are available, but in the form of monographs, we don't have any national or international standards. We are developing some standards on estimation of TLC and HPTLC evaluation also. One of the important standard published by our committee is which covers the minimum requirement on dimensional details of a droni, particularly made up of wood and fiber. For this purpose, we consulted different manufacturers of Droni, and we consulted with the different industries, and wherein they provided a list of about 11 plant species frequently used as based on the durability of plant that wood timber, and we included these 11 plant species. You can go through this standard, Indian standard number 18089. Apart from this, we included the fiber materials, tests for fiber materials also, like heavy duty fiber made up of glass reinforced plastic or fiber reinforced plastic. Included material testing for material like polyurethane foam, PUF, filled fiberglass resin also. In this standard, we provided shape and dimension for each compartment of the Droni, like what is the length and dimension of shape and dimension of head part, body part, even the handles, frames, legs, even the drainage vents also. Every details we have provided, and how the finishing of Droni made up of wood and fiber should be, and some tests like important test like adhesion test to test the durability of that product. There is a test method. We provided that requirement also. Apart from that, there are some standards which published by medical and hospital planning department. They provided some guidelines for furnitures of hospitals, general requirement for furniture of hospitals. In that, they mentioned the requirement of resistance to dry heat, resistance to wet heat, resistance to marking by oils and fats, and resistant to marking by liquids, and resistant to mechanical damage. These are all the requirement Droni should have for getting ISI or BIS certification. Apart from that, there are some clauses like marking, how the marking of the Droni should be, and packaging guidelines also included in this standard. Apart from that, another in the part 2 in this series was the specification for Shirodhara Yantra, which covers minimum requirements for and dimensional details for a Shirodhara stand, which is made up of metal or wood, and Shirodhara vessel made up of metal or ceramic or clay. For these materials, we provided specification in this standard, that is material for stand, vessel, and chain, and shape and dimension of each of the compartment, including the stand, chain, etc., and how the manufacture and workmanship should be, how the finishing of each compartment of this Shirodhara Yantra should be, and test like staining test for particularly for a Shirodhara vessel made up of stainless steel, and along with some sampling, marking, and packaging guidelines for this Shirodhara Yantra. Apart from this, this is one standard we published recently, that is standard prescribes minimum requirements and method of test for Kshara Sutra, wherein we provided details of method of preparation of Kshara Sutra, and along with the some physical requirements like what is the length and what is the weight, what is the diameter or thickness, what should be the tensile strength or breaking load of this Kshara Sutra, and some chemical requirements, the loss on drying at 105 degrees centigrade, water soluble extractive values, hexane soluble extractive values, pH, and sodium, potassium content, so total alkalis content, turmeric percentage in that Kshara Sutra, curcumin percentage, and sulfated ash, UFOL, etc., along with some sampling, marking, and packaging guidelines to maintain the integrity of that packaging. And another important standard we are developing, which is under the wide circulation stage, is a standard for Kshara Sutra cabinet, which involves with the help of electrotechnical department of BIS also we got some inputs for this. These standards gives the constructional, even performance and safety requirements for Kshara Sutra cabinet. wherein we mentioned material and construction, how the material of body, how the materials of hanger, and even the rods inside the Kshara Sutra cabinet, and the performance requirements like rated voltage range, rated frequency range, power, etc. And most importantly, safety requirements of that Kshara Sutra cabinet, like protection against access to the live parts, heating, leakage current, and electric strength at operating temperature, mechanical strength, provisions for earthing, resistance to rusting, etc. These are all the parameters included for certification of this product. Then regarding a brief regarding Ayush standardization work in International Organization for Standardization, as sir already told, we proposed a dedicated technical committee for Ayurveda and yoga at the International Organization for Standardization. Before that, we proposed a technical committee for Ayush as a whole, but as per the procedures, it was subjected for voting. We required 2/3 majority for approval of that proposal, for approval of the committee, but with a minute margin of 1 vote, we lost that proposal. And again, based on the comment received and based on the inputs received from the Ministry and BIS, this time we submitted a proposal for Ayurveda and yoga only, and we are making all the possible efforts, and the voting, I think balloting will be closed on 1st of January within 4-5 days, and by January 1st or 2nd week we will get the results of that. Though we are not working in separately for Ayurveda and yoga related standards in ISO, we have created a dedicated working group under health informatics. There is a committee, ISO Technical Committee 215, which exclusively deals with informatics part of the medical systems, and we created a working group 10, that is traditional medicine, under that committee. And last year we published a first technical report, that is health informatics, that is introduction to Ayurveda informatics. This is the first document published by International Organization for Standardization in the field of Ayurveda. And 2 more proposals. One is accepted work item, AWI, that is health informatics, related to preparation of the decocting process, is under development. And another new work item proposal, that is the information model of Prakriti, that is in informatics point of view, is also proposed in this under this working group 10, that is traditional medicine of health informatics committee. Then a few slides on a regulatory landscape. The most important is the Bureau of Indian Standards provides certification based on the BIS Act 2016 and the corresponding rules and regulations. This is a totally independent and designed to ensure the conformity without duplicating other regulatory frameworks. For Ayush sector, these are the some important regulations that are already present now, that is Drugs and Cosmetic Act, National Commission of Indian System Act, and the FSSA Ayurveda Ahara regulations, and some other guidelines like National Ayush missions, other frameworks, etc. We are avoiding, or we are excluding these aspects from, as of now we are excluding these aspects from our program of work. Mainly the rationale for this is to avoid regulatory overlap, because when there is a overlap, it may create a confusion, it may create inefficiency, and it may sometimes create conflict. That's why we excluded from our scope. And again, to ensure the clarity, when we exclude this, we can have a focused vision and we focused scope, and we develop as per our scope, and maintaining harmony with the existing frameworks. As I already told, it to avoid any conflict and to maintain the harmony, we excluded. And again, as we all know, it avoids the duplication of the efforts when we develop different standards simultaneously under different regulations. Just to explain this, Drug and Cosmetic Acts, wherein some categories of medicines like patent and proprietary medicines and Balya, Poshak, or this Saundarya Prasadaka, Aushadagana, medicinal plant extract. We are not, as of now, we are not developing, or because the Drug and Cosmetic Act provided guidelines for the issue of license of these products, so we excluded from our scope. And NCSM Act also developing some standards for education, etc. We are not certifying those, and if we need some standards for to support the implementation of these aspects, then we can have standards, but as of now we are not developing any education related standards. And again, the Ayurveda Ahara, which are prepared as per the method described in the authoritative textbook of Ayurveda, or products which have other botanical ingredients in accordance with the concept of Ayurveda Ahara, we are not developing standards, or we are not having any plan of certification as of now. Then in the end, to conclude, as we all know, as the demand increases, that exists concerns about the safety and quality. To address this, we are dedicatedly working for development of standards, but the true purpose serves when these standards get implemented. For that, we need actually the collaboration from different stakeholders like industry or